Okay, it's our Healthy Tuesday, so we cannot leave the show without discussing one thing on health. Today, we'll be discussing the importance of breastfeeding. Joining us on the show is a consultant pediatrician, Lagos State University Teaching Hospital, Dr. Ekaete Alaje. Welcome to the show, madam.
Thank you. Thank you.
Good to have you on the show.
Thank
so we
you
discuss
very much.
breastfeeding a lot. I mean, every year we touch on the matter, how important breastfeeding is. So let's start with, why is breastfeeding still important after all the technological interventions, to make things easier for everybody else? Why are you still preaching breastfeeding in 2023?
Thank you for that question. Breast milk is actually what we call the ideal food for the infants. That is like a vaccine, the first vaccine, immunization a baby will take for the rest of his life. So breastfeeding has benefits both to the child and also to the mother, even to the environment, the family as a whole. It contains several things. The misconception we have at times is that breast milk is just food, but it's much more than food. It contains much more than nutrients. When I say nutrients, I'm talking of the carbohydrates, the protein, the fats, and the mineral. It contains much more than that. It contains other things. We call it non-nutritive factors or ingredients in the breast milk. These are the things that protects the child or the baby from infection. Babies that are breastfed, they tend to, they grow well, they are healthy. And another thing we notice with breast milk is that they tend not to suffer these frequent infections, diarrhea, vomiting, ear infection, pneumonia. Most of these illnesses babies have, with breast milk, it is really, really reduced. Even if the child, gets this infection from somebody around, the risk of that child having complications from that infection is so reduced. You don't have to go for admissions, spend money on buying medications, and in short, the benefits of breastfeeding, I don't think sitting here I'll be able to say everything. It has benefits both for the child and the mother. For the mother, it helps the mother to go back to the pre-pregnancy weight. The weight of the mother before pregnancy, and mother that breastfeeds tends to go back to the pre-pregnancy, weights. And then bleeding, it helps the womb to contract. There is what we call oxytocin. It's an hormone that's, it's released to help contract the womb so that bleeding can reduce. A mother that breastfeeds the child tends to have, uterus tends to contract faster and then goes back to the normal size. So she's not having this lagging, bleeding uterus and the complications of anemia.
Okay, let me get a
blood loss.
for you.
So, okay, go ahead.
There have been myths surrounding breastfeeding. So, for example, for the mother, some people will say that breastfeeding makes the breast sag. And for the babies, they'll say by the time they want to take proper meals, they won't want to eat, other meals. And then some people may also say, especially, mothers back in the day, that they'll say that breast milk, it cannot be sufficient for the child to satisfy him. So there are myths around that. I mean, a lot of people still believe that. So may I request that you shatter the table this morning so that,
Yes, there are so many misconceptions mothers have. We see them even up till today. I'm still going to see them today in clinic. Their reason for not breastfeeding is this child keeps crying. This baby keeps crying after feeding. And what I tell them is, this is the only way this baby can communicate with you. Baby cannot talk. Mommy, I want to be carried. Mommy, my diaper is wet. Mommy, the room is too hot or too cold. So the only way this baby can communicate with you is by crying. So the crying does not equate hunger. We think that when a baby cries, this milk is not enough. Go and get infant formula. Go and give water. Go and give that. No. The baby cries for several reasons. So the mother needs to understand the cues, the hunger cues and other cues the child is trying to, show to you. So deciding to give a baby something else apart from breast milk because the baby, you feel the baby is not satisfied is actually wrong. Now, the other question that when you breastfeed, you tend to have sagging breasts. I also don't accept that. Why do I say so? Whether you breastfeed or you don't, as you keep getting older, not just your breast, but other muscles,
everything will sag.
Keep sagging.
Exactly.
Gravity draws everything down. So it has nothing to do with breastfeeding. If anything, breastfeeding helps you to keep your shape. You know, you'll go back to your normal shape after a lot of misconception. Mothers even talk about giving water to babies because it's not possible for anyone to live this life without drinking water. But what I try to tell parents, and what is known, is that breast milk is about 87% water. So the nutrients in breast milk, the other thing that is a bit high is the lactose, that's the carbohydrate. It's about 7%. You know, the protein is just about 1%, and the fat is about 4%. So at the end of the day, what the baby is taking is water. But the good thing is that this water is not plain water. It's a water that contains all the nutrients, all the things that keeps the baby, what we call antibodies, that protects the baby from infections. So it's not the plain water you're giving to that baby is filling up the baby's tummy so that the baby is not even able to take adequate fluid or adequate breast milk because you've already filled the baby's tummy with food. So that is why we discourage a child that is breastfed exclusively. Maybe I should just define what I mean by exclusive, because a lot of people talk about exclusive breastfeeding, and by the time I ask, they are saying something else. Exclusive breastfeeding means breastfeeding the baby for the first 6 months of life with just breast milk. Nothing added. No water, no tea, no juice, nothing. Unless the hospital has told you otherwise. That means the baby is not feeling well. The hospital says, okay, you can add multivitamins, you can add this. That means by the doctor's prescription. So, and then so mothers that say their breast milk does not flow. The breast milk does not flow well. Yes. Now, most of the time, the reason why that is because the mother did not initiate breastfeeding at the right time. When the baby is born, they've commenced formula for the first 1 week, 2 weeks, 3 weeks, and they now decide, I want to breastfeed my baby. By the time they decide to breastfeed...
Let us retrace. Trust me. We are both
we will tell you our different experiences.
Our experiences. Me, we push, do everything. Drag, not think.
Now, let me tell you something. Why nothing came out? The reason why nothing came out, because the rule, the law, is to commence breastfeeding within the first 1 hour of life.
Did that.
First 1 hour of life, and the baby must be on that breast milk. On that breast, suckling for about 30 minutes. Immediately you do that, within hours, the milk is already flowing. And then we need to understand that the first milk that comes out is colostrum.
We know.
And that milk is not supposed to be much, very small in quantity, but it satisfies the child, because then the capacity of the baby's tummy is very small. So that we expect that the milk should be flowing from the first day, flowing from the second day. No, it's not supposed to be that.
Okay, so I hear you, and really you're here to bust bubbles, break the table,
yes,
and empower women with the necessary knowledge so that they understand the responsibility and the sacrifice they would have to make during that period.
Yeah.
So first is to talk about the fact that, knowing what you just said, I can say that I didn't breastfeed
exclusively
within the first
1 hour.
1 hour.
Of
I don't even think it was within the first 2 hours, because I had twins and the drama was not immediate. And for those that have CS, for some cases, you cannot even have time to get yourself ready between the 1 hour. I am also not sure that many people know about that 1 hour rule. And if in some cases, some people don't get it in the 1 hour and they still have flow and others don't. So are there exceptions to this rule of suckling and the timing, and some people that just don't, they've tried and really just couldn't get it flowing?
Yeah, thank you. So that's 1 hour. Even when you did a CS, you had a CS or just normal delivery, what we call vaginal delivery, it does not stop you from breastfeeding. It's just that because of the CS, the mother is still weak, in pain, and all that. The nurses around can help support the baby or the infants to the breast. The most important thing is that this baby must be suckling on the breast within the first. That helps because some mothers tell me, I've not eaten. I've not even taken anything. Milk will not flow. But I want to tell us that milk flows, even some mothers will begin to have milk even before delivery. It's a connection between the brain and the breast. Brain and the breast. So it is that suckling activity that stimulates the brain to release the milk, and then the baby begins to suckle. So it is very important that we breastfeed our babies within that first 1 hour of life. But the theme of the World Breastfeeding Week for this year, the theme we had from the WABA is enabling breastfeeding. The sub-theme is making a difference in working mothers or for working parents, making a difference for working parents. Because most of the reason why our mothers will not even initiate or they stop breastfeeding early is because of work. So because of work, that's why I'm going back to work in the next few weeks.
You have money.
I cannot continue to do exclusive breastfeeding. So I cannot give my baby breast milk. But I'm trying to tell us here, that is what we discussed about first week of this month, that it is possible to still breastfeed your baby the first 6 months exclusively, even if you're going to work. That's why we talk to the, this time we had to talk to the policymakers, the governments, workplace, employers, to make the environment, the office environment conducive, make working hours flexible for these mothers. And then, this paid leave, thank God for Lagos State. Lagos State now gives 6 months paid leave. I think some Kaduna, Ekaete. 6 months paid leave is given. And then fathers, paternal leave, 2 weeks or 10 working days is now given to the fathers so that they can be able to support the mother. When we talk of breastfeeding, if the mother is thinking of so many things, she has so many things in the house to do, she's not in a state of mind, and that may affect the breast milk flow. But if she has the husband supporting her, family members supporting her to take care of other things in the home, this mother will breastfeed her baby.
Let me take Tony from Jos. I'll come to you, Miriam. Tony, calling from Jos. Thanks for calling.
Thank you, my sister. This is Tony from Jos. Or neither you call me God as well, whichever one that is okay by you or convenient. Greeting to you, ladies there. In fact, I'm so much interested in breastfeeding. Well, all of us receive that breastfeeding when we are baby. So to me, it's not an issue. That is why we are talking today. From our mother that gave us enough breast, especially we boys or men, I would say. So coming to the issue of lightman and soldier man, do we remember Idiabo's government? When Idiabo was in government.
Oh, we want to hear that from Tony. Thank you so much, Tony, for sharing. I would have loved to hear that view. Miriam.
Yes, I was just going to talk about the challenges of the 2023 career woman, with breastfeeding, and you've gone there. And I would just like to know, apart from just talking about it and sensitizing people, do you have any data to show that this has worked in any way? Are we seeing more corporate organizations doing the needful to provide a safe place for breastfeeding mothers to be able to still breastfeed while they're working, or have a place that they can pump milk and just keep aside? Or are we seeing more daycare centers attached to workplaces? What are you saying?
Yes. We have such. Let me start from home.
Okay.
In Lassus, we have 3 creches. They are all functional. So that the doctors, after 6 months of that exclusive breastfeeding, they come back to work and they drop their children
How about nurses?
in the creches. It's for everyone.
Okay.
Nurses, doctors, all the workers in the hospital, they keep their baby in the creches. And then the hours are flexible.
Okay.
They close early from work so that they can be with their babies. And the other thing that we also do is that flexible working hours, ensuring that the creches are functional. There are people there. Then the creches, the hospital must have a breastfeeding friendly, it must be a breastfeeding friendly workplace. That means when you have to go to breastfeed your baby, you're given the time. Somebody else can quickly do what you're doing so that you can rush to the crèche. Then we also have like a room where you express your breast milk, and then you take it to the crèche, you put it in the fridge. So it's encouraged that other people should start that. I think one of the banks, I'm not sure if it's Zenith or Access Bank, they've started it. In short, most people have started doing it. I can't, for sure exactly pinpoint, but I know that we had something like that last year where people from different organizations came and they talked about, because the private sectors are actually the ones that we are having a little bit of challenge.
I mean, Dr. Ekaete, this thing sounds so nice.
Yeah.
No, it's workable. It is actually something that...
Who pay the salaries?
That's why we said the policy workers and policy makers, the employers, the...
I'm saying who will pay the salaries? Like when you are pregnant and, I mean, when you have a child and I'm supposed to be paying you for the 3 months that you are at home, who will pay the salaries?
Okay, now there's something we need to understand. You know, the fact that you're breastfeeding or a mother breastfeeds the child, it helps you. That mother does not have to keep taking an excuse. My baby is ill. My baby, I have to take 1 week. My baby is on admission. Why is that baby ill? Why is the baby on admission? Because the baby was not exclusively breastfed, vomiting, coughing. Why? Because somebody made a mistake in constituting the infant formula.
Yeah.
So the work hour that is lost.
And the infant formula is expensive these days. Very expensive.
I agree.
Infant formula is quite expensive.
I actually, let me just say a testimony before the end of, because we're going to go out, and I had twins and we did formula, we mixed, but for my second, we had exclusive for 6 months, and the truth is we had less infectious disease, no diarrhea.
Thank you very much.
All through I love that. With the baby, and it was easier for me because the kind of work I did, I could always I carried him everywhere. I was expressing, had a little bag, and we're putting things inside. So, but there's some people that are watching right now, and
anyway, I have to, before we have to wrap up, but you see, there's something you've not addressed.
And what's that?
Mother-in-laws.
yeah,
They don't listen. No. That water, that baby will drink it. You cannot tell me that you drank water, you're okay. You know, give that formula, because nothing happens, because you can't come and kill this baby, you know? So, what are you doing? Because mother-in-laws will not listen.
That's why we are happy with it's actually, we call it family friendly. So, making it possible for the mothers, we keep talking. I'll give you an example. When I had my first daughter, my mom kept insisting, I must give this child water. Nobody survives without water. You know, and sometimes I catch her trying to, you know, quickly give the baby. But after some time, I really told her I don't want it. And please, she saw that I was really serious. She was upset that she would not watch me killing my child. So she left.
Whoa, she thought you were...
But when she came back for the naming and
saw a healthy baby.
That is what we need to do. She kept preaching it to her church members that it is possible. You need to see my child, my granddaughter, how healthy she's looking. So she's the one preaching it now. So you need to prove to her, prove to this mother. When they come to us in the hospital, I tell them, come with your husband, come with your parents. We need to let them understand. You know, so a lot of people are taking it up.
All right, we have to wrap up, but thank you very much, Dr.
Breastfeed your children.
Thank you.
Breastfeed your children.
Thank you so much.
All right, I hope you enjoyed the show as much as we have. Have a great day. We'll see you tomorrow. Bye for now.